Bismillahirrahmanirrahim. Dear students, Assalamu alaikum. Today we will discuss the most important topic, that is ARBs. ARBs means angiotensin receptor blockers. These drugs are most commonly used for the management of hypertension, for the management of congestive cardiac failure, and for the management of MI, myocardial infarction. These drugs can also be used in diabetic nephropathy. These are the most common uses of these drugs. ARBs, angiotensin receptor blockers. The most widely used drugs nowadays for the management of hypertension are ARBs, Losartan, Valsartan, Candesartan, etc. Why these drugs are most commonly used for these conditions like congestive cardiac failure, like myocardial infarction, like hypertension? Because these drugs will have number of mechanisms which will be helpful for these conditions, for treating these conditions. What are the mechanisms responsible for the curative effect of these drugs in that conditions? If you look to a condition, a part of the myocardium of that heart is necrotic. There is a lack of oxygen supply to that area, and the tissues goes towards necrosis. When the tissues are necrotic, so what will happen? The elasticity of the myocardium will be decreased. In congestive cardiac failure, that is CCF, in CCF condition, a part of the myocardium is necrotic, so the elasticity of the myocardium is decreased. So the contraction of the heart is not normal one. So the blood supplying to various tissues will be decreased. In which condition? In congestive cardiac failure condition. The tissues, various tissues like kidney, like liver, like GIT, these are demanding their requirement of oxygen, and these oxygens will be supplied by the heart through blood. And if the myocardium of that heart is necrotic one, a part of that is necrotic, so the heart can't perform its normal function. When the heart can't perform its normal function, so what will happen? The tissue's requirement will not be fulfilled. So we will have to provide the tissues their requirement, and we will also save our heart. But in that condition, our first priority will be to save our heart, because heart is going to be damaged. A part of it's also damaged. So we will save that heart. It will be our first priority. How we can save that heart? If we look to this heart, the heart is in sad condition because a part of it is damaged. So we will have decrease the load on this heart. How we can cover, how we can help that heart? We will decrease the load on that heart. If we push more and more blood in that vessel, so heart will have perform more and more function. If we decrease the concentration of blood on that heart to pass it into arteries, so the heart will be, so the load on heart will be decreased. The heart will be happy at that time. So the first one help we can do with that heart, that is we will decrease the load on heart. We will decrease the blood, the flowing of blood in various veins. We will decrease. When the flowing of blood towards heart is decreased, the load on heart will be decreased and the cardiac output will be decreased. So the first help to that heart will be decrease blood flow towards heart. The second one help, when we decrease the contraction of that heart, we can also help that heart, because When we increase the contraction of that heart, so we are putting burden on that heart, we are putting pressure on that heart. So if we decrease contraction of that heart, so that will be help to that heart. The second one help, that is we will decrease contraction on that heart. And the third help we can perform with that heart, that is decrease resistance on that arteries. The blood will goes from that veins towards that arteries, so the heart will perform, it will work like a motor. So it will push the blood to the arteries. When we relax these arteries, when we reduce the hindrance in that arteries, so the heart can easily push the blood in that arteries, so that will also be a help. Now we are going to consider that heart as a donkey. This is a donkey, and this donkey is going from point A to point B. If we increase the slope towards that donkey, so there will be problem to that donkey. If we reduce the slope to that donkey from coming from point A to point C, it will be help to that donkey. Now we are going to consider that sick heart, that is congestive cardiac failure heart, as a donkey. We can consider that heart as a donkey, and the load on it is preload, that is the blood flow from veins towards that heart. If we increase the load, if we increase the preload, that is the flow of blood from veins to the heart, if we increase, that will be burden on that heart. If we decrease the blood flow in that vessel to the heart, it will be a help. So what ARBs basically do? Suppose in congestive cardiac condition, the Losartan will causes decrease that preload. It will decrease that preload. Losartan will decrease that preload. How it will decrease, we will discuss later. When Losartan decrease that preload, the load on that heart, that donkey, when we reduce the load on that donkey, the donkey will feel good or bad? The donkey will feel good, because the load on the donkey is reduced. So the donkey can easily go from point 1 to from point A to point B. That is preload, the load, the blood going towards heart. When we reduce that, the donkey will be helpful. It is a sick heart, so we can make this donkey a sick one. The one leg of that donkey is damaged, it is necrotic one leg is damaged. So what will happen when we reduce the load on that heart, when we reduce the load on that donkey, so it will feel better. If the leg of the donkey is damaged and we increase the load, so it will be a bad effect to that heart, and if we decrease the load on that donkey, it will be helpful. So the first point, first help we are doing with that is decrease preload, the load, reduce the load on the donkey. The second one, that is the contraction, heart contraction on heart. When we reduce the contraction on heart, that will be a help to that heart. When we reduce the number of cycles, that is the heart, the donkey is going from point A to point B or from point A to point C. Suppose that donkey runs from 100 times in a minute, and if we reduce that 100 times to 60 times, it will be a help to that donkey. When we told the donkey that run, you may go from point A to point C in 1 minute to 60 times, not to 100 times, so it will be a help. And if we increase the number of cycles, if we increase the contraction, so it will be a bad effect to that of a bad point for the heart, for the sick heart. The next one, the third one help If we increase the slope from point A to point D, if we increase the slope, if we increase the hindrance, over there, so it will be a bad effect to that sick heart. And if we reduce